Here we will discuss about Parkinson's disease. Parkinson's disease is a slowly progressing neurologic movement disorder that eventually leads to disability. So it is a neurologic movement disorder and it is slowly progressing. It will lead to disability. Risk factors. The cause of most cases is unknown. Still, it believes that there are some genetic risk factors. It includes genetics, atherosclerosis, viral infections, head trauma, chronic antipsychotic medication use. Pathophysiology. Parkinson's disease is associated with decreased levels of dopamine. So this disease is primarily due to decreased levels of dopamine due to destruction of pigmented neuronal cells in the substantia nigra in the basal ganglia of the brain. So if you check the brain, if you check the basal ganglia, there is substantia nigra. In the substantia nigra, you can see the pigmented neuronal cells. These pigmented neuronal cells are the storage for dopamine. So here in this disease, these pigmented neuronal cells are destructed or destroyed. So there will not be adequate dopamine. And repeat, it is due to decreased levels of dopamine. Decreased levels of dopamine, because dopamine you can find in the pigmented neuronal cells in the substantia nigra in the basal ganglia of the brain. So these pigmented neuronal cells are damaged, so there will not be adequate dopamine. Simply says, because of the destruction of the pigmented neuronal cells, there will be decreased levels of dopamine. This dopamine you can find in the pigmented neuronal cells. So when there is a destruction for the pigmented neuronal cells, there will not be adequate dopamine. Okay. Normally in our body, neurotransmitters like acetylcholine always help for excitatory activities, to start something, to increase something. Acetylcholine helps, and dopamine inhibitory, it stops some work. So in our body there is neurotransmitters like acetylcholine and dopamine. Acetylcholine excitatory work are doing, means it will start some work, and dopamine is inhibitory, means dopamine will decrease or stop some work. So these two transmitters send messages to higher motor centers to control motor movement. So when your hand is moving or hand is doing something, or if any work, any motor movement is there, it is mainly by acetylcholine. Acetylcholine start the motor movements, and dopamine inhibit or stop the movements. So there will be a balance between acetylcholine and dopamine. Acetylcholine will start, dopamine will stop. So there is a balance between acetylcholine and dopamine. This is in the normal case. But in this case, in Parkinson's disease, as you know, there is no dopamine. Dopamine is there, the loss of dopamine. Here what is happening? There is no proper dopamine, decreased dopamine. So you can see the balance is changed. Now you can see more acetylcholine and less dopamine. So you can see lot of excitatory function, or acetylcholine work will be more, and there will not be decreased level of dopamine work because dopamine level is decreased. So you can see more excitatory neurotransmitters than inhibitory transmitters, means you can see more acetylcholine than dopamine, which will lead to an imbalance that affects voluntary movements like tremor, rigidity, bradykinesia. So in this disease, what is happening? Dopamine level is decreased, so you can see some involuntary movements, imbalance in the movements. So patient will show symptoms like tremor, rigidity, bradykinesia. I repeat, Parkinsonism is due to less dopamine level. Why less dopamine level? Because the pigmented neuronal cells where the dopamine is stored is damaged, so there is no adequate level of dopamine. Normally acetylcholine and dopamine is having a balance. So when acetylcholine will start some work, dopamine will stop that work. In this case, there is no dopamine. So when acetylcholine work will be more. So more excitatory work will be there. So it will lead to different type of voluntary movements. Like example, tremor, rigidity, bradykinesia. If you see the clinical manifestation, the three cardinal signs, this is very important, three cardinal signs are, one is tremor, then rigidity, then bradykinesia. Tremor, as you know, that there will be a type of jerking movements, and rigidity. You can see the patient muscle or body will have a rigidity. Then as patient is having some tremor, this rigidity with this jerking movements or tremor movements or jerking movements, it is somewhat we are referring as cogwheeling. So if somebody is saying cogwheeling is related to Parkinsonism clinical manifestation. Sometimes this jerking movements of patient is referred to as cogwheeling. So patient will have a tremor, rigidity, then bradykinesia. Bradykinesia means slow movement. Patient will take more time to do some activity, for sitting, for standing, for walking, for anything patient will take more time. That is a bradykinesia. Other features you can see hypokinesia, gait disturbance. Patient when stand, when walk, there will be disturbance in the posture. Then dysphonia, patient cannot speak properly. Then there will be depression, dementia, sleep problems and hallucination. Later these problems will continue and increase, and as you know, there will be a lot of complications. Patient will get urinary tract infections, respiratory tract infection, all type of infections which will lead a respiratory failure and other septicemia infections, etc. as a complications. But the main clinical manifestation, main thing, three cardinal signs are tremor, rigidity and bradykinesia. Management, one is anti-Parkinsonism medications. In this thing we are giving levodopa and carbidopa. Levodopa, the function or the action of levodopa means this levodopa will convert into dopamine, so that if you give this medicine, it will increase the level of dopamine level in body. So that actually normally in Parkinsonism there will be decreased level of dopamine. So when you give levodopa and carbidopa, it will increase the dopamine level. And anticholinergic agents, example procyclidine. If you give anticholinergic agents, what will happen? It will decrease the activity or work of acetylcholine. That is anticholinergic agents, because in Parkinsonism disease we know that the dopamine activity is less and acetylcholine activity is more. So if you give anticholinergic agents, it will decrease the acetylcholine activities. Then monoamine oxidase inhibitors, MAO inhibitors, example selegiline. If you give this MAO inhibitors, it will reduce the breakdown of the dopamine. So dopamine breakdown will be decreased. So we can get more dopamine available in that area or in the body. Then catechol or methyl transferase, COMT inhibitors, catechol or methyl transferase. Example is entacapone. If you give this medicine with levodopa or carbidopa, we can see better result. Then you can give antidepressants. So these are the management, and there are some surgical management, but normally in this case surgical management or other managements are not effective. You can only control the symptoms and signs. Mainly we will give these type of medicines, anti-Parkinsonism medications, anticholinergic agents, but there are some surgical management, but it is not that much effective. So mostly doctors prefer pharmacologic management. Thank you.